Hi guys, Dori here.
And Lauren from D Squared Classroom. So, last video we talked about how changes in volume impact the left ventricle when we discussed the Frank Starling mechanism. So, today we're going to talk about how both pressure and volume both work together to impact the left ventricle.
Yeah, and us as engineers, we love to take a complex subject and put it in graphical form. So that's what we're going to do today. And let's jump in.
Let's start by reviewing what happens with pressure over time. We'll start with the mitral valve closing. The large increase in pressure happens when the heart contracts, so it's building up pressure enough so that the aortic valve opens. The pressure continues to rise and then eventually drops off as the blood is ejected from the left ventricle into the aorta. Then the aortic valve closes and the pressure in the left ventricle drops as the heart relaxes. Then finally, the mitral valve opens and we start the process over again. Then we can look at volume over time. There are two sections of the volume curve where the volume remains stable because both valves are closed, and those are represented in pink and orange.
Let's look at the same information again, but this time plot pressure as a function of volume. So your y-axis is left ventricular pressure and your x-axis is left ventricular volume. We start once again with the mitral valve closed. The first phase of this diagram is isovolumetric contraction. This is the point where your heart is building an electrical activity and your ventricle literally starts to contract. So you're squeezing the blood, so no volume is moving, which is why you have this vertical line at one volume. However, the pressure is increasing because you are physically squeezing on the blood. At this point, the aortic valve opens. At first, you have an increase in pressure because your ventricle is still squeezing on the blood. However, we have a decrease in volume because blood can actually flow out of the aorta. Then there's a decrease in pressure when you start to run out of blood volume to squeeze through. At this point, your aortic valve will close. The next phase is isovolumetric relaxation. There is no change in volume, which is why you have, again, a vertical line because neither valve is open, so your blood cannot come in or out of the ventricle. However, because it was just contracted, it now relaxes, and this leads to a decrease in pressure. At this point, the mitral valve opens again and blood fills the ventricle. This leads to an increase in volume and a slight increase in pressure. The loop then repeats itself. The mitral valve closes, which corresponds to a volume called the end diastolic volume, or the volume in your ventricle when it is full of blood. You have isovolumetric contraction. The aortic valve opens and blood flows out of the ventricle. The aortic valve closes, which corresponds to the end systolic volume, or the volume in your ventricle after blood has been ejected. Then you have isovolumetric relaxation. Your mitral valve opens and allows for filling again. The distance between the two vertical portions of the pressure volume loop is the stroke volume. Essentially, this is the difference between the end diastolic volume, or when your ventricle is full of blood, and the end systolic volume, when blood has been ejected from the ventricle. Essentially, the stroke volume is the amount of blood that moves through the ventricle with each pump. Patients that have conditions such as heart failure, when your heart is not able to pump adequately, have a decreased stroke volume. It is not able to push the amount of blood it needs to out of the heart. This narrows the curve.
Now, let's look at that same pressure volume graph, but in active form. This is what we call the PV loop, and we can pretend that we're collecting real-time data from a patient in order to show the movement of pressure and volume with each beat. Now let's imagine that that patient that we were just recording the curve for had a poor stroke volume and needed some help with their cardiac hemodynamics. So we'll add a balloon pump, and you'll see how this immediately starts to change the shape of the curve. The first noticeable change is the width of the graph, which represents an increase in stroke volume with the pump on. You'll also notice that the graph moves down and to the left, which means that the pressure has reduced, but also that the volume has changed, specifically the end systolic volume, and a reduction in end systolic volume also means an increase in ejection fraction.